All good? Thanks for coming along, and I've been joined by Associate Professor Deb Friedman, who's part of the Acting Chief Health Officer team in Professor Sutton's absence this week on leave. The last few weeks have shown us, all Australians, just how delicate and hard fought the gains that we've made as a community are when it comes to beating the coronavirus. In these last 2 weeks, around 12 million Australians in 4 states and territories have been subject to lockdowns, particularly in response to the fast-moving Delta variant of concern. And that Delta variant of concern has made its way out of hotel quarantine and into communities right around the country. The efforts of the Victorian people have been outstanding as we have run to ground simultaneously both a Kappa variant imported from South Australian hotel quarantine and a Delta variant that leaked out of, we suspect, hotel quarantine, but still unaccounted for. But what the situation right across Australia has shown us is that none of us can be afford any sense of complacency until such time as we are fully vaccinated. The good news is that the position here in Victoria is stable, and that means that we can ease our restrictions further. But with the slower than forecasted rollout of the Commonwealth's vaccination program and the reduction in traveller caps yet to take effect from the National Cabinet decision, and the outbreaks in interstate jurisdictions to our north, all mean that our public health experts have urged us and recommended that we continue to act carefully and cautiously as we move out of those restrictions. So the good news is that from 11:59 p.m. Tomorrow, Thursday the 8th of July, restrictions in metropolitan Melbourne will be brought into line with those of regional Victoria. All COVID-safe settings will apply consistently right across the state. Masks will continue to be required indoors and in public-facing settings unless an exemption applies, but they will no longer be required at schools for students and staff, and they will no longer be required at workplaces, particularly if you don't interact with the public. For example, in offices, factory settings, and in other arrangements where the huge uptake in QR code systems that so many Victorians have picked up give us a substantial alternative. I am sure that we will see more people, as a result, come back to our offices, which will in turn assist our retail, our hospitality, and our business districts continue their recovery. Masks will still be required if your role sees you interacting with the general public, for example, if you serve customers in a retail setting. As part of these changes, a range of venues right across Melbourne will now be able to apply the same density limits, freed up density limits that apply in regional Victoria. This further opens workplaces including entertainment, retail, hospitality, gyms, physical recreation, community facilities, creative spaces, galleries, places of worship, and more. The limit will be 1 person per 2 square metres, provided that in some cases COVID check-in marshals are on site just to make sure that people check in every time, everywhere. Dance floors will also be allowed with a COVID check-in marshal, but no more than 50 people on the dance floor at any one time. We will keep the limit on private gatherings in place with up to 15 people able to attend a home per day. I think Victorians need look no further than the outbreaks across our borders to know and appreciate the risks that continue to attend coronavirus spreading through indoor domestic settings. Crowd numbers will also be able to increase at public events. Outdoor stadiums can increase up to 75% of their capacity, up to 40,000 people as a cap. Indoor stadiums can open to 75% of their capacity, up to a 7,500 person cap. Theatres will also be able to open to 75% of their capacity, up to a cap of 2,000 people. All of these settings will apply for 14 days, but of course they are always subject to the changing epidemiological risks as advised by our public health team. There will be further information, as there always is, at www.coronavirus.vic.gov.au, and when these orders come into place, they will be, as they always are, put up on the web. They will actually this time around be signed by our Acting Chief Health Officer, and that is our Associate Professor Deb Freeman, who joins me here today. Deb is an infectious diseases expert and established and is still part of the Barwon Health team, but has been working with our Department of Health Infection Prevention and Control team for some time. And I'll hand over to Associate Professor Freeman to update us as to particularly local and interstate data and risks. Thanks, Deb.
Good morning. Thanks, Minister Foley. So we've got 0 new cases locally acquired reported overnight in Victoria, and that now makes 1 week with no locally acquired cases in Victoria, which is certainly good news. There were also 0 new cases in hotel quarantine reported. Overall, we have 24 active cases of coronavirus in Victoria, and 5 of them are locally acquired. At home, things do remain stable. We've got 174, and this is over 80% of the primary close contacts associated with the Sandringham outbreak that have been cleared. And further clearances are expected with regard to the Virgin Air crew, and that's going to commence in the coming days. 6 contacts remain in Victoria from the Tanami mine, and all of these people are in isolation. And we've still got 20 published exposure sites on our Coronavirus Victoria website. I'm very pleased that Victoria will be able to take these further cautious steps announced by Minister Foley at 11:59 p.m. tomorrow night. These steps are taken recognising the incredible achievements that Victorians have made in overcoming the recent outbreaks, but we also recognise the significant risks that remain on our doorstep. We have red zones in place in Greater Sydney, and this includes the Blue Mountains, the Central Coast, Shell Harbour and Wollongong. We also have red zones in place in Brisbane, Moreton Bay and the Sunshine Coast. The remainder of New South Wales is all orange, including the ACT. The Perth and Peel metropolitan regions in Western Australia and both Darwin and Alice Springs are also orange zones. And further into Queensland, Townsville, Magnetic Island and Palm Island, and also the local government areas which include Ipswich, Logan, Redland, Gold Coast, Lockyer Valley, Noosa, Scenic Rim and also Somerset are all orange zones. It's no small thing to change a zone to either red or orange, and our border permit settings for people who've been in red and orange zones broadly match the advice that we give to people that have been to higher risk exposure sites within the state. And so we do take this risk seriously. In the last 2 weeks, we've seen 2 incursions, and that produces hundreds of primary close contacts and then dozens of exposure sites. As Minister Foley said, with this Delta variant, and just as we saw with our experience with the Kappa variant, all it takes is 1 case to cause a much larger outbreak. 1 infectious case going undetected in the community for a few days is something that we really don't want to contemplate currently. We've had over 9,000 people returning to Victoria from red zones since June, and we've had over 65,000 returning from orange zones. We know that yesterday there were over 400 red zone permits and over 3,000 orange zone permits in the system for people arriving. And we're continuing to review our travel permit settings daily based on changing epidemiology. Where there are updates, we're going to provide them with as much lead time as possible so that Victorians will know what to expect. And in the meantime, we still continue to advise Victorians not to travel to orange or red zones. Our engagement teams that are supported by Defence personnel made 365 visits yesterday. Unfortunately, the majority of these permit holders were doing the right thing. We know that 354 of these people were from New South Wales. We did identify a small number, 4 people, that were intentionally not isolating, and our teams do investigate those and refer them to the authorities where appropriate. A few further points. Yesterday there was over 27,000 tests processed, and this is a really outstanding number of tests which we're really pleased about. 99.2% of these results were turned around by the next day, so we're really happy with the turnaround time for testing. And just a reminder for people who are arriving on orange zone permits by road, particularly if you're coming from regional New South Wales, we're hearing from our colleagues at Albury-Wodonga Health that they're seeing a great deal of queuing for tests immediately on the Victorian side of the border. So to make things easier for yourself and for the people at the border community, remember that you've got 72 hours in which to get tested while you're isolating in Victoria. So if your destination is either Melbourne or perhaps another regional town within Victoria, consider driving directly to your destination and getting there and getting tested when you get home. In terms of vaccines, there were 15,784 doses administered yesterday, and that makes a total of 1.2 million doses administered through Victoria's state-run centres in total. Of the 15,784 doses that were administered yesterday in our health services, more than 14,000 of these were for the Pfizer vaccine, and 2/3 of those were second doses, adding to the increasing number of people that are fully vaccinated. For the rest of the week, we've got more than 24,000 first dose Pfizer appointments in the system and more than 37,000 second dose appointments booked. Finally, and pleasingly, there have been over 4.5 million QR code check-ins across the state, and we're encouraging all Victorians to continue to check in everywhere, every time. Please get vaccinated if you're eligible, and please get tested the moment that you have symptoms. And if you're interstate and you're returning home, know your zone, get your permit, and then follow the health advice from there. And I'm going to hand back to Minister Foley now for questions. Thank you.
Thanks, Deb. Any questions?
Is hospitality still seated service only, or are people allowed to stand up and drink now?
It's normal service, but the only restriction is the DQ 1 to 2. The seated service is for venues, so hospitality, retail. The overwhelming measure is DQ 2, so that's the measure. A few places have for very high risk 4, but it's pretty much 2 universally.
No changes to visitors in the home outside of 15 ways.
So what we have learned over the course of this pandemic is that our homes, whilst we think they're our castles and they're the places where we assume we're the safest, they're also the places where we let our guard down and where we've seen transmission occur on many times. It seems a bit counterintuitive, but it's borne out time after time, and we've seen it again in those settings to our north. 15 is a careful number, but it's a number that the public health team are comfortable with. And also by freeing up retail, by freeing up public gatherings, the view is that that will give us enough of a alternative location where people can gather safely with QR codes, with density quotients in place that will keep people safe.
So we can hope in 2 weeks' time we can revisit that and maybe increase the private gatherings.
As Associate Professor Friedman indicated, we review all these things daily, but absolutely the intention is that with the careful, cautious progress that we're making, that we would have a view to review all of these for further easing in a few weeks' time.
On the 4 people that were intentionally not isolating, are they the same people that weren't isolating in previous days?
No, these are more people. There's additional people.
How many people have you got out checking on people that are meant to be in isolation? Who's doing it and how many?
So by the time you include all of our team at the airport, who are meeting all the flights from both orange and red zones, plus the Australian Defence Forces support, plus our own authorised officers, it's several hundred people. I can get the exact figure to you shortly.
And what happens if you get caught not isolating? Do you get a fine straight away?
It depends on the circumstances, but fines, substantial fines, are available, and each case is determined on its merits. But fines are a very real reality that people need to contemplate if they're not following the rules. The red zones are where virus is circulating in the community. We want, particularly as we come to school holidays ending, we know that people have got to come home, and we know that they've got to come home safely. But please, the rules are there to protect you, to protect your family, and to protect the hard-won gains that Victorians have achieved. So if you're coming back from a red zone, follow the rules. You will be contacted every day, and whether it's police or the armed forces, the random checks will find you if you aren't following those rules.
Reviewing our position every 14 days instead of every week, is that a direct connection to Sydney still finding cases in their community?
That's part of it. We know that with so many thousands of people returning from red zones where the virus is still circulating, poses us a risk. So what we're looking for is a degree of certainty and predictability for communities, for businesses, for organisations, but at the same time, enough of a process to make sure that as our continued recovery and improvement gathers pace, we can put in place systems that continue that steady progress.
And what is your response to Sydney extending its lockdown for another week? Do you think it was a good decision to stop the virus spreading anywhere else around the country?
I've seen media reports. I'm not sure if the New South Wales government has formally indicated that position yet, but like all these things, each state makes its informed decisions based on its public health advice, and should New South Wales determine that that's its position, that would further reinforce our view that these red zone measures, particularly as they apply to those areas of New South Wales, are there for very good reason.
Can you please just clarify on the mask rules indoors? Obviously not for schools and workplaces, but if you're going to a restaurant or a cinema or a church or anything else, what is it? The rule there?
So it's fundamentally the position that if you are in a position where you're exchanging with other people in an indoor setting that's not your workplace, that masks continue to be part of the requirement. It's about applying the common sense arrangements that masks work, they keep us safe, they're low cost, they're not much of an imposition, and they're highly effective.
Does that mean you'll have to wear a mask on a dance floor?
I might take a rain check on that one and get back to you.
In an office, would the receptionist have to wear a mask then if she's...
It would all depend on what is engaged with public exchanges. So common sense will overwhelmingly apply here. If it's internal to your workplace, then no. But if you have dealings with members of the public, and many receptionists do, then yes. Each case will be determined on its circumstances and on its merits. And we know that overwhelmingly, as part of the QR code system, as part of the social distancing arrangements, that this is just another layer of protection to keep us all safe.
Do you think masks inside would come off in 2 weeks' time?
We'll take advice from the public health team as things progress, but as you can see, each of the steps are taken are proportionate to the risk that we're facing. We still have risks. We still have a very low vaccination rate compared to our OECD countries that we like to compare ourselves to. We still have the risk of hotel quarantine that will be halved in coming weeks, and we still have the risk of red zones and people returning from those red zones into Victoria where the virus is circulating.
Queensland's only reported one case over the last couple of days. Does that mean it's likely to change from a red zone anytime soon?
That Sydney,
Queensland's only
Queensland.
been reporting one case.
I wouldn't bank on it changing anytime soon. Let's wait and see what Queensland, it's only a small area of Queensland. I think it's 3 local government areas, but that's under daily review. If you are currently in those areas and you want to get back for school starting again, don't bank on them changing to orange. They may well, but that will be based on the evidence from the public health teams and their exchanges with their interstate colleagues. But if you're coming back from those areas and it's a red zone, you must get tested and you must isolate for 14 days.
It's been a week with 0 cases. What's stopping us from easing restrictions at, say, 11:59 p.m. tonight?
Well, we want to give people predictability. We want to give people the systems that we indicated that we would 2 weeks ago, that these arrangements that were currently in place would be for 2 weeks. They are going to be in place for 2 weeks. People need to get organised, and we think that's a sensible degree of certainty for business, for community, and for the state.
Events and live music venues. So can you clarify what capacity they can operate? Because under former restrictions,
So the capacity that was 300 goes off, and the capacity will be linked to your square meterage.
Okay, because under previous restrictions, some were still only operating under 30 to 40% of full capacity. So that doesn't really.
So that would depend on their size, and there was that cap in place of a maximum of 300. Depends on how big your venue is, and your square meterage, and your COVID marshal arrangements in place. Hence the 1 to 2 per square metre arrangement.
Still operating at less than 50% capacity when there's been no cases in the community.
Well, it would depend on the circumstances, it would depend on the size of the venue, and it would depend on each case having to be determined against the new public health measures. But this will be a substantial freeing up for a substantial number of venues.
Can you also just clarify, it's a bit unclear what the rules are for offices in terms of that 75% limit up to what?
Again, based on their per square metre arrangement. So it's if your workplace is a particular size, then you've got 75% of your total arrangements based on 1 per 2 square metres. If there's particular examples that you've got issues with, I'm sure we could answer those.
75% or up to 30 people if total workspace is 40 or less.
So that's for smaller venues. So we always make sure that particularly small businesses and smaller venues, we always try to accommodate a more reasonable cap for those smaller companies, smaller retail, smaller hospo, to make sure that there's a more reasonable cap than just a simple per square metre rule.
When do you foresee these businesses can go back to business as usual?
A big pardon?
When do you foresee that these businesses can go back to just operating as business as usual, given the
So we're moving gradually, carefully, and with a degree of certainty to a COVID-safe environment. But normal will be when we are fully vaccinated and when we have a system in place that manages our quarantine risk that doesn't rely on hotels which were built for tourists. And when we have that in place, that will be the normal that I'm sure all Australians will put every effort into achieving.
So given the low vaccination rates, the fact that we're in winter now, do you anticipate that we won't be heading back into those settings that were in place in March for some time until maybe after winter and more people have access to vaccines?
So risks will be managed proportionate to the circumstances as they develop. We didn't have the Delta variant in March. We didn't have, but on the other side of the equation, we hope that we have higher vaccination rates. We hope that we have a halving of the risk associated with the changes that National Cabinet agreed on hotel quarantine. We hope that the fast tracking of the fit for purpose quarantine facilities will be able to occur. And we hope, particularly underpinning all of that, that we get more access to vaccines so as all Australians can be vaccinated safely and make that big step towards a COVID-safe future.
On Grand Prix quickly, if I can, are you confident that, as Health Minister, it will return next year safely?
Well, as Minister Pakula indicated yesterday, and the Australian Grand Prix indicated yesterday, we are very confident that the Grand Prix will return in 2022. That is all predicated, the original decision earlier this year, as you will recall, was predicated on the Australian government's, Commonwealth government's commitment that we would be fully vaccinated by October. Clearly that isn't going to happen. We are determined to make sure that we do our bit here in Victoria to make sure that we are fully vaccinated for every person that is eligible and comes forward to get a vaccine by the end of the year. That all depends on supply. If that's the case, the equation changes, whether it's for the Australian Open, whether it's for the Grand Prix, and whether it's for the large number of other international teams and sports and events that will flow in 2022.
Go ahead at this rate?
Well, again, the same equation applies. The Australian Open was successfully carried out earlier this year, and we look forward to it being similarly carried out in 2022. Again, making sure that we're all vaccinated, that the Commonwealth provides the states with the support they need to achieve that will be the critical factor in determining that.
There's been some criticism today that Victoria was one of the states calling for international caps to be cut, and then yesterday your government was blaming that as one of the factors having to cancel the Grand Prix. Isn't it a bit rich for your government to be leading that charge and then point the finger at it as one of the reasons we can't host the event?
No, not at all. I don't think it's rich that the Victorian government places the keeping the economy open, keeping our events happening so far as we possibly can, keeping our community safe. I don't think that's rich at all. What National Cabinet decided was that the risks associated with hotel quarantine, particularly with the Delta variant of concern, during a very low vaccination period was such that, as we've seen right now, right across New South Wales and Sydney and parts of Queensland in the last week or two, where 12 million of our fellow Australians were in severe lockdown, that's the risk that National Cabinet rightly identified. And I think it would be rich if the Victorian government or any other government ignored that reality. The measures that National Cabinet have taken with Victoria's support are sensible. Yes, they have implications, and the implications are pretty tough. But the real tough choice is, what do you want to do? Do you want to lock everyone down, or do you want to lock a few people out? And the way in which you solve both of those problems is to have everyone vaccinated.
Were you involved in that decision to cancel the Grand Prix?
Well, involved insofar as I'm a member of Cabinet, but the decision came through based on, as Mr Pakula indicated yesterday, the requirement that the Grand Prix needed a degree of certainty and predictability now that the public health team were unable to give them. On exactly the same basis, I'm involved that the Singapore Grand Prix was cancelled and the Canadian Grand Prix was cancelled this year. These are unfortunate realities in a global pandemic. And I'm confident that those circumstances that required that to happen in 2021 will not apply in 2022, provided the Commonwealth gets to the states and the GPs and anybody else that wants to partner in a massive national rollout of vaccination programs, the vaccines that we need.
Officer, just quickly. On masks specifically, they're off in offices now, but obviously still in those indoor environments. Is that going to be a fixture for at least the rest of the winter, do you think? Should people be ready for that?
I think we should expect that wherever we think that vulnerable people are or where there might be risk of transmission, that masks will remain. So I think, as an example, there wouldn't be any changes to be expected in healthcare settings, aged care, disability care, where we'd be concerned about vulnerable people. In other areas, if it's safe to remove masks, we'll do so. But I think we're going to have to closely watch how things go.
Why do we need the full 2 weeks? Deb? We've already had a week of no community transmission. 2 weeks was always the goalpost last time around. So why do we need a full 2 weeks?
So, as you correctly say, we've stated 14 days, but we're going to look at things on a day-to-day basis and remove restrictions as soon as we possibly can. I think what we do know that will happen in the next 7 to 14 days is a lot of people returning from red and orange zones, and I think that's where the concern lies for Victoria, is the risk of further incursion into the state from returning travellers. So we're going to watch this closely with a view to remove restrictions as soon as is possible.
All good.
Just one more question for sorry, on another topic. Sorry. Do you support an inquiry into Victoria's gambling regulator, given what we've seen over the last couple of days?
I think the Premier addressed this yesterday. The Victorian government accepts that the gambling regulator is broken and is determined to fix it. And I think the Premier also indicated yesterday that there's a Royal Commission in place and it wouldn't be appropriate to run a commentary on the Royal Commission's proceedings. If the Royal Commission thinks that this needs to be taken further, then the Royal Commission will say so.
The Royal Commission isn't examining the gaming regulator, so do you think there needs to be a separate inquiry into that?
Well, I think the Premier addressed this pretty fulsomely yesterday. So 2 things. The Victorian Government accepts that the current model of the casino regulator is broken and needs fixing and is determined to do so. It would not be appropriate to run a commentary whilst the Royal Commission is active and in session, and that, having said that, should the Royal Commission believe that it's needs further expansion of those terms of reference and this particular or any other issue needs inclusion in its work, the Royal Commission, I'm sure, will say so.
Did you get the updates on the meeting yesterday with General Fruin, the wargaming about vaccines? Is there anything significant to come out of that for Victoria?
Yes, I did. We thank General Fruin and his team for engaging with all the states. It allowed a few different scenarios to be played out that could then help inform certain circumstances for how the rollout will go forward practically. What we're really looking forward to is the ongoing discussions about when can we get more vaccines into Victoria. Can I just point out that over the next 6 to 8 weeks, Victoria will see a real reduction in vaccines into this state. During May and June, we ramped up considerably through our vaccination program, and we thank the Commonwealth for allocating extra, particularly Pfizer vaccine, to Victoria during that period of time. The inescapable reality is that over the next period, before the spring, Victoria will have a cut of vaccines to our state. And again, this whole vaccine rollout that the Commonwealth is leading has had its challenges, and I think the Commonwealth would accept that. I'll ask people to cast their mind back to February, March with the Commonwealth's original plan. The Commonwealth predicted at that stage that the states would have a minority of the responsibility for distributing vaccines. In Victoria, it was going to be somewhere between 25 and 30%. As we stand here today, our state vaccination clinics are distributing 50% of the vaccines in this state. And that's because we've built that open access, widely distributed model right across the state with over 40 vaccination clinics. We are going to have to scale those back over coming weeks, and we hope for not too long. And what we're looking forward to is conversations with the Lieutenant General and his team about how can we source more vaccines into our state to make sure that our state vaccination clinics can operate, that our GPs who want to distribute more vaccines can operate, that our pharmacies, and I've learnt from discussions that we've also had with business groups and others that are meeting the Commonwealth Government today, how can all of our business communities, our trade unions, our civics communities, our NGOs, how can we all make sure that we do our bit to get anyone who wants to be vaccinated so we can have that return to something that equates a normal life that we are seeing in other comparable jurisdictions around the world. We can't do that when we don't have the vaccine.
To what extent will you be scaling back?
Beg your pardon?
To what extent will you be scaling back?
Well, it'll all depend on precisely what we land from the Commonwealth. So Lieutenant General Fruin's horizons have a minimum number and a maximum number. If it's the minimum number, the scale back will be significant. If it's the maximum number, it won't be as large, but it will be real. And one of the good things is that we're talking to Lieutenant General Fruin and his team about is, well, if that has to be the case, what can we do in that period to do things differently and more effectively, particularly for those communities that we know are underrepresented in current vaccination rates.
25 to 30%, do you think, or what the state should be delivering?
Well, we'll provide that once we get the degree of certainty that the Commonwealth will provide us over July and August. The actual numbers come in pretty accurately in terms of what the Commonwealth forecast on a weekly basis. And whichever way it is, the sad truth is that we will have to scale back that capacity over the next month or two, but we want to maintain that capacity so when in the spring the promised increase comes, that we can ratchet that straight up again. So in the intervening period, what can we do to use that workforce in a creative way to address particular problems with the available vaccinations for communities, parts of the state, parts of the suburbs that are underrepresented in vaccinations at the moment.
Based on this meeting yesterday or otherwise, when do you think we'll be able to offer Pfizer to people under 40? General Fruin mentioned September or October.
Well, we'd take the Lieutenant General's advice. We don't control the supply of Pfizer, Moderna or others. Sadly, we don't have an mRNA production capacity in this country. Victoria is leading engagement with industry as to how we can achieve that. We're totally dependent on international imports for mRNA vaccines. When the Commonwealth gets it, when the Lieutenant General and his team can distribute it, we will put it into people's arms.
Can I ask one more selfish question? Masks at weddings. When it comes to why, like when it's easy to contact trace, and obviously you've got a full guest list, you know, QR codes, why are they still in place? Or are they still in place?
I might ask Associate Professor Friedman, but I'll ask the question of Associate Professor Friedman.
So we're expecting that when they say "I do," that they won't have masks on. I think that goes without saying. I think during in a setting where people have all checked in for the event and we're able to easily contact trace, and where people are going to be consuming food and beverages, we'd expect that common sense would prevail and masks wouldn't be worn in that type of setting.
So you don't need to wear a mask at a wedding if you've got all those things in place?
If you've got all of those COVID-safe settings in place, then masks don't need to be worn at weddings. You're getting married? Oh.
We'll end on that happy note then, shall we? There we go?
Yeah, that's fine.
Very good.
Thank you, Professor.
Thank you. Thanks, guys. Bye.
Turn my phone off, I go and sit down with a message. And that was it. And this one I watched TV a long time. Here I am doing the third.
Yeah.